Hello, and welcome to the San Andreas Emergency Medical Training and Introduction course. Over the next several minutes, this film will teach you the skills necessary to provide basic medical care using the advanced role-play environment diagnostic script. Are you ready? Let's begin. The ARE diagnostic script is a virtual treatment menu that allows you to treat injuries using various techniques. Toggle the menu by pressing H on your keyboard when you are near another person. To open the menu on yourself, press Y. If you are in a crowded space where there are several people present, select the three-person icon in the top right corner and easily select your desired patient from the drop-down list. Standard operating procedure dictates that the first step in medical treatment is to verify the health status of your patient. Check the anatomical graph for areas highlighted in pink or red. This means that your patient is injured. Click on the highlighted regions, and the actual injuries will appear in the text box to the right. Text highlighted in red tells you that an injury is severe and requires immediate treatment. To determine just how sick your patient is, you should always check your patient's level of consciousness, pulse, and blood pressure before starting any medical treatment. To check the patient's consciousness, select the Check Consciousness button in the main menu. Consciousness tells you how awake, alert, and aware someone is. When a person becomes very sick or injured, they can lose all consciousness. If this happens, it is important to work quickly, since an unconscious person can struggle to breathe on their own. To check for a pulse, select the Check Pulse button in the main menu. A pulse tells you how fast the patient's heart is beating. Anything lower than 50 or higher than 100 could be dangerous, so watch the patient closely. To check blood pressure, select the Check Blood Pressure button in the main menu. Blood pressure tells you how forcefully the blood is moving around a patient's body. A healthy blood pressure is approximately 120/80. Numbers that are too high or too low could mean that the patient is very sick or injured. These three measurements together, consciousness, pulse, and blood pressure, are your first glimpse into a patient's health status, so always pay attention and repeat them frequently. If a person is seriously injured or sick, it is possible that they will go into cardiac arrest. During cardiac arrest, the patient's heart has stopped pumping, meaning that they will have a pulse of 0. When cardiac arrest occurs, you must follow a set order of tasks to ensure maximum chances for survival. First, confirm the arrest by checking for a pulse. If the pulse comes back as 0, the patient is in cardiac arrest. Next, you should immediately begin chest compressions. Select the chest on the live anatomical graph and select Perform CPR. CPR is an emergency procedure consisting of chest compressions combined with artificial ventilation. After the CPR progress bar is complete, the third step is to connect your patient to the LifePak monitor defibrillator by selecting the chest on the live anatomical graph and selecting Connect to LifePak. This function is available by pressing the defibrillator icon at the top of the menu. The LifePak provides live feedback of the patient's pulse and blood pressure. If CPR is effective, the patient's pulse will increase. If CPR is ineffective, the patient's pulse will remain at 0. After the CPR progress bar is complete on your second round of CPR, if there is still no pulse, you may attempt defibrillation by selecting Shock. Don't worry, the defibrillator will not shock the patient unless it detects a shockable electrical rhythm in the patient's heart. The fourth step in cardiac arrest is to manage the patient's airway. Insert an iGel supraglottic airway by selecting Insert iGel under the main tab. Inserting an iGel will ensure the patient is receiving adequate ventilation for the duration of the arrest and after. Keep in mind that cardiac arrest can often be caused by injuries themselves. When cardiac arrest occurs secondary to injuries such as gunshot wounds or similar trauma, it is absolutely crucial that immediate attempts be made to stop bleeding, even if it means delaying CPR. For more information, consult your supplementary training materials or ask your supervisor. More often than not, your patient will be conscious and able to talk, scream, or cry, indicating that they have an open or patent airway. For some, however, you will need to assist them in opening and maintaining their airway. In most cases, it is best to start simple. If your patient is struggling to breathe and they are unconscious, insert an OPA and deliver oxygen. If your patient's condition worsens, an advanced airway may be necessary. As previously mentioned, iGel supraglottic airway devices can be inserted by navigating to the main tab and selecting Insert iGel. There are two main medical gases available on your ambulance, oxygen and Entonox. These gases are compressed into cylinders, which can be conveniently carried. Oxygen is the primary treatment for hypoxia, meaning low levels of oxygen in the body. It should always be given to people with serious illnesses or injuries. When in doubt, give oxygen. Entonox is a combination of 50% nitrous oxide and 50% oxygen, otherwise known as laughing gas. It's a very useful painkiller. Simply select Entonox from the drug list and repeat as necessary for continued pain relief. Never give Entonox to an unconscious person. As an emergency medical technician, you have access to a small range of medications for use during medical emergencies. While medications are not always necessary for every patient, they are one of the many valuable treatment tools you possess and are helpful when used properly. To administer your desired medication, simply click your chosen target site on the anatomical graph and select it from the drop-down list. Keep in mind that many of the drugs available on your ambulance are reserved for paramedics and advanced EMTs only. For more information on how to select the right medication, consult your supplementary training materials. Normal saline is a solution that can be used to replenish fluid in a patient who is bleeding or experiencing low blood pressure. Volumes of 500 and 1,000 milliliters are available. Before starting the infusion, navigate to the main panel and place an intravenous catheter. This procedure can sting, so explain to the patient that they may feel a sharp pinch. To select normal saline as your infusion, navigate to the Infusions tab and select your desired volume while an arm is selected on the live anatomical graph. Warning: normal saline only provides a temporary solution to blood loss. If available, request a paramedic so that blood products can be transfused. The human body is a complex system of living tissue that can be damaged due to injuries. There are 9 different types of injuries that can happen anywhere on the body. Each type affects the victim in different ways and has a set of treatment procedures that are best suited for that specific injury type. While some injuries might cause a slow trickle of blood loss, others might kill the player instantly. There are many bandages available for treating injuries of all severities. They can be found by navigating to the bone icon at the top of the menu and selecting your chosen bandage while the injury is highlighted. For best results, including compatibility information, consult the Wounds and Bandages table, which is available in your supplementary training materials. Regardless of the bandage you choose, work quickly. Prioritize bleeding control and fluid replacement with a crystalloid solution, such as normal saline. Do not delay transport, especially if a hospital is located nearby. This concludes the San Andreas Emergency Medical Training and Introduction course. The skills you've learned today, from assessing patients to administering medicines, will be essential tools in your new role as an EMT. For more information on the content of this film, or if you have questions, speak to your supervisor or your department's medical director.